Hi there, this is Ramesh Singa again from Falls Spine Pain, interventional pain physician, and we're still here with Drs. Pond and Dr. Agato, and we're talking about physical therapy still. We're going to do a role play here where Dr. Pond is a patient and Dr. Agato is going to do an assessment for Dr. Pond, who's had low back pain for 6 months, and her pain is starting to radiate down her right leg, and it's really been hard on her life. We've done an epidural injection, and the pain just keeps coming back after about 3 months, so we'll see what can be done.
Right. So Michelle is my patient today. So she'll just give you guys a little bit of background, like what she's feeling, what she's going through. This is typically how we would start the session, is just a subjective, talking a little bit, getting to know you. So she's going to give me a little detail, and then we'll typically go into assessment, but we'll kind of jump through into more of the treatment options so you guys can see what that looks like.
So Larissa, I've been having pain for off and on, I'd say probably 6 months of stuff that's actually limiting me. And I went to see Dr. Singa probably after 3 months, which is probably too long. And I got an injection and I felt good. And then I kind of got back to life and it just slowly started to creep back. And it's coming down my leg and I feel it a lot when I'm sitting, which is kind of discouraging because you feel like when you sit, that should be when I feel good. And sitting, driving in the car, and then like when I lay down at night, sometimes I'm feeling limited and waking me up at night, and I think it's just starting to get a little frustrating. And so he referred me to you guys, and I think I'm just trying to figure out what the best next steps are.
I'm so glad that you're here because we can definitely help you with these symptoms. I think at this point there's a lot that we can work on. We'll do an assessment, figure out what your current deficits are so we can make some change. And the injection is great. We can make sure we get some real improvement now that you're having a little bit of reduced symptoms from that. But I think next steps, now we're going to get into a little testing here to see what kind of range of motion you've got, strength, and then we'll go into some exercises you can start doing at home to help get the party started here.
Great, awesome. Sounds good.
Of course, we'll do a little bit more in here than you do outside of here, but we'll make sure at least you're keeping things going so that you're not having too much time in between sessions where you're inactive.
Great.
Now, at this point, usually we would do a little bit more in-depth assessment of strength, range of motion, reflexes, some functional testing where we get her up off the table moving, depending on how severe the symptoms are. That may be shorter or longer of a segment. And then we would go into the education like we just talked about as far as the home exercises. So that's what we definitely want to show you today, since there's some things that maybe you guys can take from this video if you haven't been into PT yet, but this case sounds a lot like your case. So the first one is going to actually be to help reduce those symptoms that go down your leg, Michelle. Now, that is usually a nervous system issue. So your nerves are causing you to have that pain that goes down the back of the leg. So sometimes there's ways we can modify that nerve symptom by doing what are called nerve glides. So this one's going to require you to lay on your back. So I'm going to have you lay on your back, and that's perfect, just like that. And now the first thing you'll want to do is actually hook your hands behind one of your thighs. So if this is the leg that usually gives you problems, you'll hook it there. And then what you're going to do is just straighten out this leg as high as you can comfortably get it. And when you get to the point where you're like, okay, that's about all I've got, then that's great. And you're going to slowly come back down. That's it. And now this exercise, what it's doing is elongating that nerve and then relaxing that nerve. So it's moving back and forth almost like you're flossing. It's giving that nerve a little bit more space to run through the tissues. So this is all you need to do. You'll go up and down like this. And as far as the repetitions go, you really can't do too many of them. But I will say, at least if you can get a good round of at least 12 or so in a row to make sure that you're not stopping too early, we really want to make sure we're elongating that nerve. Most of the time, you may feel like, okay, I'm just getting tired holding my leg, and that may be one of the reasons you need to stop, and that's okay. But this is one, it's more for symptom modulation. So you can do it until you feel like you've got some relief, and then you can take a break, and do it again if you need to. But I always tend to advise people to do it a couple of repetitions more than just as soon as they feel the symptoms relieve. So you want to go a little bit beyond once you feel no symptoms. But that's exercise number 1. This next one, Michelle, we're going to have you laying on your side. So let's have you face this way, laying on your side, and your knees are already bent in the perfect position. This one you can modulate where you're going to get the mobilization based on where your knees are. So if your knees are a little bit lower, you're going to actually be getting more of a lower back mobilization, so you're going to get more lumbar. If you raise your knees up a little higher, then that's going to actually travel up the spine and have you mobilize more thoracic and upper region here. So if you are specifically having low back pain, we'll probably want your legs a little bit down here. So just neutral here is fine. You don't have to have your knees straight behind you or anything like that. This is a good starting point. It's just what feels normal when you lay down. If you do have a little more upper quarter symptoms up here, then we might have you tuck your knees a little bit closer. But this is the starting point. What you'll do now, Michelle, is have both of your hands in front of you, just like that. That's perfect. And now you're going to want to take this top hand and just open it up and rotate as far behind you as you can. And I love that you're looking at your hand, because that's the goal for this one. You really want to look at that thumb the whole time, and then you'll come on back. Once you feel like you've made it as far as you can, you'll bring those hands back together. This one we call an open book stretch. So this one really can help mobilize not just the lumbar spine, but thoracic spine and cervical spine all in one stretch, because we're getting that rotation at each component there, especially if you're looking at your hand as you rotate. And it's definitely modifiable. If you're feeling some discomfort in a certain range, you don't have to push through that range. You just stop when you feel the discomfort and come on back and close the book. And you will usually find that the more repetitions you do, the further you're able to go without discomfort. So we definitely recommend for this one as well, trying to get at least 10 to 12 of those in a row before switching sides. But we always do recommend doing each side, even if your symptoms are only on one side, because we want to make sure we're getting that adequate mobilization in each direction. This looks great, Michelle. Awesome. You got great mobility. I'm going to have you just keep your feet together here, and we're going to do an exercise that's called a clamshell. It's something that is going to really target a lateral muscle here that's called your gluteus medius, and it's very important for stabilizing your spine and amongst a lot of other things as far as helping with gait mechanics, things like that. But this one usually plays a huge role as far as back symptoms, and tends to be a little bit irritated sometimes with back pain. So we want to find a way where we can activate this tissue that's not going to flare it up. And this is usually a good first start. So the first exercise is going to be called a clamshell here, like I mentioned. She'll keep her feet together. And now, Michelle, I'm going to have you just lift your top leg, just the knee is going to open up to whatever height you can manage, and then come on back down. And now she's doing a really good job already of keeping her hips nice and stacked on top of each other here, because what we want to try to avoid is actually rolling her whole body backward as she twists. So let's demonstrate a bad one so they can see. Yes, so rolling back completely is just going to make your core and your back muscles kind of turn off for you. You want to make sure those are active the whole time and they're really stabilizing your spine. So this one isn't just about that glute med. We're also getting core and trunk extensors working too. So if you really keep things nice and aligned here, keep those hips stacked on top of each other, this is that leg that's just getting that motion going up and down to whatever height you can get. And now this is one we start with no resistance, and then eventually you can add a resistance band around the knees to give you a little bit more load if this starts to feel easy. But start with about 12 reps of these. If you start to feel like it's getting easier, increase the repetitions, and then at that point, if you're doing 30 in a row and you feel like it's a piece of cake, we're ready to add some resistance, or maybe even change the exercise altogether. But this is a good one to start, let's say, if you just want to try this at home and you don't need any equipment for it. So typically we would do both sides. You'd get 12 here, 12 on the other side, and you can alternate between the sides back and forth until you get about 3 rounds on each side. So let's chat about at least one other exercise to do. This is another one that will access similar tissue and still make you have to really stabilize the spine in a way that's not too aggressive, and you still get to lay on the table. So The next one, you're gonna straighten out this top leg. You can still leave the bottom leg bent because that's actually gonna give you a little bit of extra support and stability here. It's a little bit harder if the leg is straight underneath you, so definitely start like this. The amount of bend doesn't really matter as long as it's bent a little bit. Now the top leg, you do want to stay as straight as possible. And what you're gonna do is also try to keep that alignment here, keeping everything in a straight line, trying to keep those hips stacked on top of you, just like we did for the clamshell. And now this leg is the most important one. You don't wanna let this leg come too far forward. We wanna have it right in line with your body. And sometimes it may feel like it is, but oftentimes people will think that their body is in line here when really their leg's a little bit in front. So for this leg lift exercise we're gonna do, I often tell patients to lift the leg up and a little bit behind them, because often that will actually make them just go straight up. But this one is called sideline hip abduction, or just a sideline leg raise. So what she is doing here is great. She's keeping her knee nice and straight. She's really stabilizing here, not letting her back arch as she lifts her leg. She's doing a really good job engaging the core, and you're gonna feel this one in the side of her hip. Most of these exercises that we do for the glute med, you'll feel in that lateral side of the hip here. And this one is a little bit harder than the other one. So tend to start with more like 8 to 10 repetitions, see how you feel with that, and also get that 3 rounds on each side. But this one is a little more fatiguing. So we definitely start a little bit slower with this one. If you're feeling symptoms with any of these, we do recommend just stopping for now. Always, of course, check in with your PT in the area, see if you can get an evaluation, because they will help you figure out what's really necessary for your specific problem. But these are a good start if you have a similar case to Michelle's case today. But this looks great. That's awesome. Thank you, Michelle. All right. I love
Thank
it.
you guys so
I
much.
think that worked out pretty well. That's a good take again. Not bad. Thank you. Great.
So we have talked quite a bit about physical therapy and how it can be an integral part of pain management and getting back to life, activity, etc. And so visit your physical therapist. Austin, Leander, Liberty Hill
Yes.
area, and many other places I don't know about. But we're in Texas, so.
Thanks.
I love it.
That was good.
Yeah.
Amazing.
That was great.
Good.
Woo!